Health Unraveled. 10 signs your liver is struggling. Your liver is performing over 500 jobs right now. Yes, right now. While you're watching this video, it's filtering toxins, producing proteins, storing energy, and basically keeping you alive. But what happens when this powerhouse starts to fail? Your body sends out warning signals, some so subtle you've probably been ignoring them for months. Stick around, because some of these signs are happening to 60% of people watching this video, and they have absolutely no idea. Let's unravel the truth about your liver. Welcome back to Health Unraveled, where we break down complex health topics into information you can actually use. Before we dive in, here's something wild. Your liver is the only organ that can completely regenerate itself. You could lose 75% of it, and it would grow back. Pretty incredible, right? But here's the problem. Your liver is also a silent sufferer. It doesn't have pain receptors, so by the time you feel something's wrong, the damage might already be significant. Today, we're covering 10 warning signs that your liver is struggling. Some are obvious, others will surprise you. And here's the challenge. Count how many of these apply to you. Drop your number in the comments. No judgment, just awareness. Let's get into it. Sign number 1. Unexplained fatigue that coffee can't fix. Sign number 1. You're exhausted. Constantly. We're not talking about that 3 p.m. slump you fix with an espresso. This is bone-deep fatigue that follows you from the moment you wake up. You could sleep 10 hours and still feel like you ran a marathon. Here's what's happening. When your liver struggles, it can't efficiently process nutrients into energy. It's like having a clogged fuel filter in your car. The engine just can't run smoothly. Your liver also helps remove toxins from your blood. When it's overwhelmed, those toxins accumulate, making your entire body work harder just to function normally. The result? You feel drained, foggy, and perpetually tired. Quick test. Has your fatigue lasted more than 2 weeks despite adequate sleep? That's your cue to pay attention. But fatigue alone isn't enough for a diagnosis, which is why the next signs matter. Sign number 2. Mysterious itchy skin. Your skin itches like crazy, and there's no rash. This one confuses people because you're scratching and scratching, but when you look, nothing's there. No bumps, no hives, just relentless itching, especially at night. Here's the science. Your liver produces bile, which helps digest fats. When your liver isn't functioning properly, bile acids can build up in your bloodstream and deposit under your skin. These bile salts irritate nerve endings, creating that maddening itch. This is called cholestatic pruritus, and it often affects your arms, legs, the palms of your hands, and soles of your feet. People spend months trying different lotions, antihistamines, and dermatology appointments, never realizing the problem is internal, not external. If you've been scratching yourself raw with no visible cause, your liver might be sending an SOS signal. Sign number 3. Your belly is expanding, but not from food. You might notice your pants getting tighter around the waist, even though your diet hasn't changed. You look down and your belly seems distended, almost like you're pregnant. This is called ascites, and it happens when fluid accumulates in your abdominal cavity. When your liver is damaged, it can't produce enough albumin, a protein that keeps fluid in your bloodstream. That fluid then leaks out into surrounding tissues. Also, when blood flow through a damaged liver gets blocked, pressure builds up in the portal vein, the major vein that carries blood to your liver. This pressure forces fluid into your belly. Here's how to tell the difference from regular bloating. Ascites tends to be persistent, doesn't fluctuate much with meals, and your belly button might start to protrude. You might also notice swelling in your ankles and legs. This is a red flag that needs immediate medical attention. It means your liver is already significantly compromised. Sign number 4. Bruising like you've been in a fight. Sign number 4. You bruise extremely easily. You bump into a table corner, boom, massive bruise. Someone taps your arm, bruise. You don't even remember injuring yourself, but suddenly you're covered in mysterious purple marks. Here's what's going on. Your liver produces clotting factors, proteins that help your blood coagulate and stop bleeding. When your liver is struggling, it can't make enough of these proteins, so your blood doesn't clot properly. The result? Blood vessels break more easily, and when they do, the blood leaks into surrounding tissue, creating those telltale bruises. You might also notice you bleed longer than normal from small cuts, or your gums bleed when you brush your teeth. Now, occasional bruising is normal, but if you're suddenly bruising from the slightest touch, or your bruises are appearing without any known injury, your liver's ability to produce clotting factors might be compromised. Pay attention to the pattern. Is this new? Is it getting worse? Those details matter. Sign number 5. Your urine looks like dark tea. Dark urine in the morning can be normal if you're dehydrated. Drink some water and see if it lightens up. But if your urine stays consistently dark brown or amber throughout the day, even when you're well hydrated, that's concerning. Here's why. When your liver can't process bilirubin properly, a yellow pigment produced when red blood cells break down, it builds up in your blood. Your kidneys then filter it out, turning your urine dark brown. This is often one of the earliest visible signs of liver dysfunction, and it frequently appears alongside another sign we'll cover in a moment. Pro tip: check your urine color against a pale background, not in the toilet bowl where it's diluted. First morning urine in a clear cup will give you the most accurate reading. If it's consistently dark like tea or beer, especially combined with other symptoms on this list, don't ignore it. Sign number 6. Pale or clay-colored stool. Yes, we're talking about poop. And yes, it matters. Normal stool gets its brown color from bile. When your liver is healthy, it produces bile that flows into your intestines and gives your waste that familiar brown hue. But when your liver is struggling or bile ducts are blocked, bile can't reach your intestines. The result? Your stool becomes pale, gray, or the color of clay. This is the partner symptom to dark urine. When bilirubin can't go through its normal route into your intestines, it reroutes through your kidneys instead. So you get dark urine and pale stool simultaneously. If you notice this combination, dark urine plus pale stool, this is a strong indicator of a bile flow problem, and you need to see a doctor soon. Your bathroom habits are actually one of the most revealing windows into your internal health. Don't be embarrassed to pay attention. Sign number 7. Brain fog and confusion. Sign number 7. Your brain feels like it's swimming through molasses. You forget why you walked into a room. You struggle to concentrate on simple tasks. Conversations feel harder to follow. You might feel confused, disoriented, or just mentally slower than usual. This is called hepatic encephalopathy, and it's seriously underdiagnosed. Here's the mechanism. Your liver normally filters ammonia and other toxins from your blood. When it can't do this effectively, these toxins travel to your brain, affecting cognitive function. Early stages might just feel like brain fog. You chalk it up to stress, lack of sleep, or getting older. But as it progresses, it can cause mood changes, personality shifts, and in severe cases, confusion or even altered consciousness. If you've been feeling mentally cloudy, forgetful, or just off for weeks, and you can't figure out why, consider getting your liver function checked. Sign number 8. You're turning yellow. This is the classic liver warning sign everyone knows about: jaundice. Your skin takes on a yellowish tint, and the whites of your eyes look yellow or even slightly green. This happens when bilirubin, that pigment we talked about earlier, builds up so much in your bloodstream that it starts depositing in your tissues. Bilirubin is yellow, so you turn yellow. Now here's an important distinction. Jaundice is usually a sign of significant liver impairment. By the time you're visibly yellow, there's already substantial damage or blockage happening. The yellowing often appears in your eyes first, specifically the whites of your eyes. Then it spreads to your skin, starting with your face and moving downward. How to check? Look at your eyes in natural daylight, not artificial lighting. Pull down your lower lid and check the whites. Ask someone you trust if they've noticed any yellowing in your skin or eyes. If you notice jaundice, this is not a wait-and-see situation. This requires immediate medical evaluation. Your liver is waving a giant yellow flag. Sign number 9, loss of appetite and nausea. Sign number 9, food just doesn't appeal to you anymore. You sit down to eat your favorite meal and nothing. No appetite. The smell of food might even make you nauseous. You might feel full after just a few bites. When your liver struggles, it affects your entire digestive system. Bile production decreases, making it harder to digest fats. Toxin buildup can trigger nausea. The pressure from ascites can make you feel physically full. Your body is also smart. When it's dealing with internal distress, appetite often decreases as a protective mechanism. Here's what makes this tricky. Loss of appetite can come from a million things: stress, depression, other illnesses, so people rarely connect it to their liver. But combined with other signs on this list, it becomes significant. Pay special attention if you notice sudden aversion to foods you normally love, especially meat and fatty foods, nausea that comes in waves throughout the day, unintended weight loss, feeling full immediately after starting to eat. Your digestive system and liver are intimately connected. When one struggles, the other feels it. Sign number 10, swollen ankles and legs. You take off your socks at the end of the day and see deep indentations. Your shoes feel tight. You press your finger into your ankle and it leaves a pit that slowly fills back in. This is called peripheral edema, and like ascites, it happens when fluid leaks out of your blood vessels into surrounding tissue. When your liver can't produce enough albumin and other proteins, fluid regulation in your body goes haywire. Gravity pulls that fluid down to your lower extremities, your ankles, feet, and legs. You might also notice swelling that's worse at the end of the day, puffiness that improves overnight when you're lying flat, skin that looks stretched and shiny, difficulty putting on shoes that normally fit. Now, swollen ankles can come from heart problems, kidney issues, or simply standing all day. But when it appears alongside other liver symptoms, especially abdominal swelling, fatigue, and jaundice, it points toward liver dysfunction. Your body is retaining fluid it normally wouldn't, and that's a sign your liver's regulatory functions are compromised. All right, let's recap the 10 signs your liver is struggling. 1. Unexplained chronic fatigue. 2. Mysterious itchy skin with no rash. 3. Abdominal swelling. 4. Easy bruising and bleeding. 5. Dark tea-colored urine. 6. Pale or clay-colored stool. 7. Brain fog and confusion. 8. Yellowing skin and eyes. 9. Loss of appetite and nausea. 10. Swollen ankles and legs. Now here's what I need you to understand. Having one of these symptoms doesn't mean your liver is failing. But if you checked off multiple signs, especially combinations like dark urine with pale stool, or fatigue with brain fog and swelling, it's time to get checked. The good news? Your liver is remarkably resilient. Caught early, many liver conditions can be managed, reversed, or significantly improved through lifestyle changes, medication, or treatment. The tests are simple. A basic liver function blood panel can reveal a lot. Your doctor might also order imaging, like an ultrasound, to get a visual look at your liver. Remember, your liver doesn't hurt when it's struggling, so you have to pay attention to these indirect signals your body sends. So, how many signs did you count for yourself? Drop a number in the comments. And if this video gave you valuable information, smash that like button and subscribe to Health Unraveled. We're breaking down health topics like this every week. Your health is in your hands.